Hello, Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cacho with PAR5 Physical Therapy here in Randolph, New Jersey, and I partnered with them to bring you an easy and educational workday session for today's hybrid workplace. So today's session is pain-free mobility, unlocking joints for better movement. A little bit about me. I received my doctorate in 2010 from Mercy University, and I've been in the PT and fitness field for over 25 years. I'm an orthopedic clinical specialist, a certified golf medical professional, golf fitness instructor, and level 1 CrossFit trainer. I'm also certified in dry needling and functional movement techniques. So we're going to use a lot of that, a lot of my experience here in what we're going to be talking about today. So to make this as helpful and informative as possible for you, go ahead and use that chat feature to let me know if you have any questions, specific stuff that you want to go over. But without further ado, let me pull up my slides here, and then we're going to get started. So pain-free mobility, unlocking joints for better motion. So, life is about movement, right? We all know movement is important, but not all movement is created equal, because we want to be able to move well and move often. I always use the analogy as movement being like your vocabulary. We learn vocabulary from an early age as we develop. We talk about rolling, crawling, squatting, walking. Now, if we don't practice those pieces of our vocabulary, our movement practice, then we tend to lose it. Oftentimes, people come in to see me and they're having issues with general everyday stuff, or they want to perform better in the gym or play better in their sport. But one of the things that I take them through is a movement assessment. And we look at how everything moves, how their entire body from head to toe, neck, shoulder, back, hips, pelvis, knees, ankles. Look at the entire body to assess how they're moving. And one of the tests is, how do you perform a squat? And how do you get up and down from the floor? So those are things that give us a lot of information about how you negotiate everyday movement problems and how durable and resilient your body is. So maintenance is important for any machine. And if we think about our bodies as being very complex machines, we want to be able to maintain them as much as possible. This is a quote from another physical therapist. His name is Kelly Starrett. And, this is so true for a lot of people that come to see me. But on the other hand, if you're able to maintain your body with certain stretches or exercises or techniques, we want to also understand and know when we need to go see a specialist. Using the car as an analogy, what side the gas tank is when you go fill up your gas tank, or how to put air in the tires, right? Or maybe even how to change your oil. But if your transmission goes out or the electronics are going on the fritz, you need to go to a mechanic. So it's very similar with your body, that we should have some type of movement practice or exercise routine that we engage in that's outside or more intense than just everyday walking. A lot of times people will come and say, you know what, I'm active, I go in the yard, I garden, and I take daily walks. But true fitness really stems from the ability to kind of do more work at a high level of intensity. So we want to make sure that our exercise or workout, our fitness routine pushes our ability to perform to a certain point that makes changes in our body. All right. Now, because I'm a medical professional, I have to put up this disclaimer that, this is not medical advice. This is not physical therapy. This is information that is aimed at a general and broad audience. So if you're dealing with something specific, some pain or injury, make sure that you get a thorough physical exam and assessment so that you can have all the associative factors, all the root causes that are causing the problem that you're dealing with, have them treated and assessed thoroughly. All right. Now, if you've been to any of my classes before, this video should be super recognizable. I played this at every session that I've had. And if you take one thing away from any of my classes, remember this, that our bodies function on this alternating pattern of stability and mobility. So if this pattern is disrupted, then usually pain or injury is the result. So this is really eloquent in explaining why we may have like knee issues or back issues. And if we look at this pattern here and the roles that these segments are designed to take, if their role is compromised, then or reversed, we typically, our body compensates by making the next segment above or below, reversing that role. For example, our lower back, if that's supposed to be stable, and our hips or our T-spine, our thoracic spine, that's supposed to be mobile, becomes tight, it essentially becomes a stable segment, and then maybe our lower back reverses its role to make up for that loss of range or mobility, then it becomes an unstable or mobile segment. So those are things that we want to work towards and maintain. And remember that the fact that when you have pain or injury, the pain or injury might not be where the problem is, all right? And pain can exist and be present without any tissue damage or trauma, all right? So pain is very complex. But anyway, we're going to talk about how are we going to restore this stability and mobility pattern. Super easy to do if we understand and go back to this, right? So I would say of all the people that come to see me, you know, shoulders are very common injuries, as well as lower back. Probably 80% of people that come to see me have some type of a lower back issue, and then the shoulder, and then the knee. And if we look at the shoulder is supposed to be a mobile segment. And the next thing that's connected to that is the scapula or the shoulder blade. That needs to be stable. The shoulder blade is like the foot of the arm, right? So if you're trying to move or lift or implement something or do something with your arm, the shoulder is supposed to be mobile, but the shoulder blade needs to be stable so that you can generate force or torque with your hand and with your extremity. The other thing is we talked about the back we mentioned. And then if we look at the knee is a very simple joint. All it does is just bend and straighten, right? So that's classified as a stable segment. Nobody wants an unstable or mobile knee. You know, when their knee gets wobbly, that means that there might be some ligamental damage. But the joint above or below it, right? Above it is going to be the hip. That's supposed to be a mobile segment. And the joint below that, that's the ankle. That's supposed to be mobile. And a lot of times people come in to see me, they have really limited ankle mobility. So when your foot's on the ground, and let's just say you're lunging or squatting or trying to pick something up off the floor, or get up out of a chair, or get up out of a car, or take stairs, for example, and the ankle is tight or not so mobile, the knee tends to, again, reverse its role, becomes a mobile segment. And the same thing for the hip. We want to make sure our hips are as mobile as possible and they fulfill their role so that this pattern doesn't get disrupted. So the top 3 exercises to rejuvenate your body, right? Rejuvenate your joints, mobilize. So they pretty much come into these things here. Trigger point releases of some sort, all right? Back stretches. Lower backs are kind of very common, and thoracic mobilization. That's a big one because that addresses a lot of issues. Mobilizing your thoracic spine, your T-spine, your mid-back, upper back, that could reduce low back pain or reduce shoulder pain. All right, so we're going to get into these and see what we can do. Let me pull up my my 2-shot here. All right, so the first thing I have here is just this massage ball, right? And you could use anything that you have at home. It could be like a tennis ball or a lacrosse ball. Let's just say we have a tight muscle. Now, muscle is, when you think about it, just pieces of fiber, pieces of meat that are 3-dimensional, and they need to be mobile, slide short or contract, and also slide long or lengthen. And if we think about how all these muscles are integrated in our body, they're right next to another piece of meat, another piece of muscle. So those surfaces, they need to slide against each other. So we'll take some type of ball, tennis ball, lacrosse ball. I've got this massage ball. And then the first thing that we'll do is we'll start on the back. So you give yourself some room, get on the floor. Again, this is one of those tests. Can you get down on the floor? You should be able to get up and down from the floor without much issue or support. And if you can't, that tells you that you've got a problem, and then you need to address it. So starting out, we're going to put this ball on the lower back. Now, we want to stay off of the spine, and we're going to go to the side of the spine and below the ribs and above the pelvis. I'm going to lie on my back, and from here, I'm just going to slip that right underneath that spot. So again, above my pelvis, below my ribs, and to the side of my spine. And then what I want to do is just work on my breathing, because anytime that we do some type of trigger point release or foam rolling or some type of self-myofascial release, whatever you call it, our body goes into this fight or flight response, especially if there's a trigger point there, if it's really tight. Fight or flight responses, increase the contraction of the muscle, it increases the tone, it increases your heart rate, blood pressure, whatever. But getting into a deep breathing pattern where we go in and out through the nose, 2 seconds inhale maybe, and 4 seconds exhale, maybe holding your breath or pausing as needed, reduces that fight or flight response, that sympathetic nervous system response, and allows your rest and digest side of your nervous system, your parasympathetic nervous system, to be more active. When we're trying to release a muscle, it takes about 1.5 minutes for the sympathetic nervous system response to be controlled or be reduced. And then this parasympathetic nervous system response starts to kick in. So we go from that fight or flight to the rest and digest. So it takes some time. As you're going through this, you kind of can reposition it as much as you need to find those spots. And then we're just going to roll maybe gently from side to side. It doesn't take a lot of motion. When you feel comfortable and you feel like you can tolerate the pressure on the ball, then we can start to add some hip motion. So the hip letting the knee lean out to the side or bring it back to the middle, leaning out to the side. That can increase the pressure and reduce the pressure as we're moving the hip. Again, hip is connected to your pelvis, which is also connected to your back. So as we move one limb, we influence what's going on in another part of our body. Another technique, if we need more pressure on the ball, or if the ball's too small or the surface that we're on is too soft, we could bring the knee into the chest. And as we bring the knee into the chest, that really pushes the back into the ball. So again, whatever we do with changing the leg and hip position, that kind of resets maybe that fight or flight response. So you want to take at least 2 minutes to be able to kind of release that. And if you're having tightness on both sides, I would do it on both sides. All right, 2 minutes each. And then once we're done mobilizing that area, we're going to work on stretching or moving the area, right? So moving the joint. So we worked on the lower back. We want to move that joint. And the easiest way is to get into this quadruped position on your hands and knees, and then work on flexing or tilting the pelvis backwards, which rounds out the back, and then tilting the pelvis downward, which arches the back. And we're taking those joints through a large range of motion, whatever feels comfortable for you, and none of this should hurt. We never want to be able to, kind of push through pain. We just want to feel like we can control this motion in this position here with my knees on the ground, my hands on the ground below my shoulders, and my knees below my hips. My back is supported in this quadruped position. So as you're going through this, it might be a little uncomfortable at first, but it should not be painful. If it is, you just make your range of motion smaller. And then as you get comfortable, we start to go a little bit larger and larger. The key with this is to try and keep the movement as isolated as possible in the area that we just mobilized with the ball. So the big mistake with this is to really focus on the upper back, to try and round out the upper back and then arch the upper back. We don't want a lot of this upward back or head motion initially. We want to just really be focused using the abdominals to tilt the back and round out the lower back.
and then using the lower back muscles to arch it or sag it into the ground. So doing these two motions, very focused into the lower back and your pelvis, allows those joints to move. Now, every joint in the body has what we call synovial fluid. And synovial fluid is like the oil of your body. It helps to keep the joints lubricated. If you are static and not moving, that synovial fluid can become very viscous and thick, and then it becomes less mobile. Things feel stiff. Like you can imagine, like sitting and watching TV or watching a movie for 2 hours or sitting on a plane, and you're not moving, and all of a sudden your knees or your legs or your back gets stiff. And this is very natural. To produce synovial fluid or to decrease its velocity and make it less thick and make your joints more mobile, we have to move. Movement in a joint allows the cells inside that joint to produce more synovial fluid, all right? So it's always important to move, all right? So we have the cat-camel. As we get more comfortable with that, we could talk about going into bigger motions. But before we do that, I want to work on my thoracic spine, my T-spine. So I'm going to grab a foam roller. Now, foam rollers come in a lot of different sizes. This is half of a foam roller, but they're all round and they can come in different densities. This is rather hard, but if it's uncomfortable for you to do this, you could certainly grab one that's softer. All right. This is a great one to counteract our position that we're normally in throughout the day. Because our world in industrialized society, we're always down in front of us. So our upper back and our head tend to be rounded and our head tends to be forward. So this is a good one to kind of reverse that. I have a lot of my golfers do this, and a lot of any athletes that do overhead throwing sports do this move, because if we're rounded in your thoracic spine, that limits the ability for it to rotate and your shoulder to go overhead. So that can impact your ability to play sport. So we're going to start this foam roller maybe somewhere on my rib cage. We want to stay on the rib cage because that's where the thoracic spine is. I'm going to support my head with my hands here, and we could start to, go up and down. You've probably seen people do this in the gym, basically to mobilize the tissue and loosen things up in the upper back. Now, today is all about the joint. So to mobilize the joint, what I'll do is I will get to the lower, roll that foam roller, so it's on my lower ribs, and that's the lower thoracic area. I'm going to keep my knees and hips bent here. My hips are locked into the ground. My feet aren't going to move now. I'm going to assume that same position with my hand, but I want to bring my shoulder blades away from the spine. And I do that by pulling the elbows together and forward. All right, so what that does is it separates my shoulder blades, gets them out of the way, and also creates tension through the upper back. And we could do it this way as well, just kind of giving yourself a hug, and then that gets your shoulder blades separated. To mobilize the joint, we will have to go deeper than the soft tissue. So we want to create that tension, and creating that tension is basically taking up the slack of all the soft tissue that's around it. So when we do this move, it's going to go and be more effective into the joint, versus if we have slack and we do this move, you're not going to feel much of a joint mobilization. So same position, elbows together, and then what I'm going to do is I'm just going to rock my head and shoulders back to the ground. Now, what I'm doing here is with my hips and knees planted in this position and stable, everything is stable from the foam roller down. I'm taking my upper back and the top of my thoracic spine, and I'm extending it, mobilizing the joint that's directly on top of that foam roll. So as I go back, I'm getting that mobilization through there. It's not going to be a lot of motion, but you go with what you can tolerate and initially, and then as your back loosens up, you can go a little bit farther and farther. Now, there's a couple more levels of your spine here, your thoracic spine, so we're going to move this down maybe about 3 inches, and then repeat that process as you go back. And the more often you do this, the more loose your upper back will be, and the more mobility you'll have in your thoracic spine. The key also with this is to not take the mobility from your lower back. So if I allow, let's say my upper back is tight, and then I allow my lower back to kind of arch, I can go really, really far because I'm really extending through the entire spine. What I want is to be very focused on where that foam roller is. So I'm going to have to engage my abdominals and keep my lower back rounded or flat as I take the top half and go backwards. So I don't want any movement from the foam roll down. All the motion comes from the top end as I go back, and I repeat that as I go. And then it's just very focused. You want to push into that foam roll and be very deliberate and focused with it, and feel that joint over the foam roll release. And if you don't have that stability down low, you're just going to go back and you're not going to feel this as much. All right, so that's thoracic spine. And then as we improve the thoracic spine mobility, then that will improve the ability to go overhead. Because if you're really rounded and then you're going up like this with your shoulder, for example, that will limit the ability for you to truly get you to full range of motion if we don't get that, that mid-back extended. Okay, so those are three things, and that can be applied with a lot of different joints in the body. Foam roller, you could do it to your thigh, the back of your thigh, the calf. You can do the front part of your shoulder with one of these balls. So, and then the biggest thing is to move those joints, mobilize those joints for at least 2 minutes, get them lubricated, have those joints produce the synovial fluid. And that will preserve these joints and unlock them, because if you don't move, then you tend to get stiff and you lose it. All right, so let's take a look at the chart here. So we've got, yeah, those trigger point release, the back stretches, the thoracic mobilizations, covered all that. And our ultimate goal is to restore this normal stability, mobility pattern in the body. All right, so I'm going to take a look at our thing here. Oh, got a couple other slides. Didn't know that. So anyway, the ultimate main goal is, as we're trying to restore that normal mobility stability pattern in your body, we want to maintain function and your body's resiliency, right? So this is part of how we maintain our durability as we age. One analogy I like to use is like, you know, your fitness, your wellness, your health being like your finances, right? So if we're going to retire, we want to be able to build that wealth over our working years. As we're younger, we're putting money away in the bank, saving it, 401k, so that later on we can withdraw that money as we retire. And the same thing goes for your health, your fitness. You want to be able to build that as you're younger, through your 20s, 30s, 40s, and then in your 50s and 60s and 70s and 80s, you can kind of withdraw from that fitness bank because you've built up your body and you become more durable. And it's never too late to start. All right, so that's another lesson. So you want to build a resilient body and maintain function. Let's see here. Oh, the hip flexor stretch. This is a good little stretch here. So this is another thing that helps with sitting. If you're sitting, because your body assumes the positions that and adapts to the positions that you're in, this is a great anti-sitting exercise. There's many different ways to do this, but in my opinion, you need to stabilize the areas that the muscle is connected to. The hip flexor comes from your lower back, dives through the abdominal cavity, and inserts into the front part of your hip. So you want to make sure that your glute is engaged and your lower body, your lower back, your core is engaged, so that when you do this stretch, it's very specific in where you feel it. A lot of times people will just, again, hyperextend their lower back until they feel it in the hip. All right. This is another exercise. Once you open up the hips or increase your flexibility, we want to be able to activate those muscles in the back, the glutes, to reduce the stress on your lower back. So when we're bending or lifting or moving things, as you're picking something up off the ground, instead of using your back, we want to use the glutes. So this is one way to do it. We want to make sure that we're pushing through the heels and driving those knees forward as you're doing that with the core engaged, because that will
increase the activity and target your glutes properly. All right. So once you can move better, you'll feel better. And we want to build our ability to perform any skilled or sport activity based upon this movement hierarchy pyramid. We want to make sure that we have a good base of this pyramid before we start to engage in higher level stuff. All right. So body mechanics, one of the moves that I take my clients through is that we look at how you squat. That's one of the things I mentioned at the top. And once you improve your range of motion and flexibility, then we can refine and improve the way that you move and then improve your everyday function. All right. So squats, I had a client the other day come in and say, you know, she had some knee pain and her orthopedic surgeon said, you should never do squats anymore. I'm like, well, that's a joke because I had her, you know, I had her show me her squat. It didn't look great. And then I had her go sit down on my couch and I had her stand up. I'm like, what do you think that was? And that's a squat. When you get up off of the toilet or get up out of a chair or a couch, that basically is your squat. So we want to maintain this range of motion. And I told her that, you know what, these mini squats that you're doing actually increases the compressive force on your patella and your kneecap on your knee. But squats that are below 90 degrees actually doesn't decrease. It actually reduces your knee compression when you get past parallel. All right. So physiologically, everybody should be able to squat. One of the tests that I take people through is this thing. If you can stand or lie on your back and bring your knees into your chest, that shape of your hip and your knee is basically what could be your squat. And the same thing, you could do it in sitting too. If you bring your knee into your chest, that's basically, if you look at the position of her hip and her knee, the hip is above, the knee is above the hip. So the shape of the bottom of the squat is very much similar to what you do in this position. And if you can do this, but not do this, then generally it's a problem with the ankle. If you stand with one foot in front of the other like a tightrope, and you could hold on to a wall or something, this is a quick and easy test. Test your mobility. You need to be able to bring your knee forward past your other front ankle without lifting the back heel down, right? So this is a super easy test that you can do. Just stand up, put one foot in front of the other, hold on to your desk or chair, and then as you bring both knees forward, if that heel, that back heel pops up before that knee can go in front of that ankle, that front ankle, then that means you have a tight ankle. And that's probably the reason why you can't do these squats. All righty. So I think that is it. Oh yeah, there's another one. There's like secret slides I have here, PT myths. One myth is that you need a prescription from a doctor to go see physical therapists. No, you don't. You know, physical therapists are primary care health providers for any musculoskeletal issue. So you don't need a prescription to go see a PT. You could see one without it. And also, people think that you only need to go PT when you're hurt or you have pain. You don't. If you went to your dentist whenever you had a toothache, then you wouldn't go to your dentist that often. But you go every 6 months, or you should go to your dentist every 6 months to have your teeth checked out. And also you have an annual physical from your primary care physician just to check up and everything to make sure that everything's working fine. And the same thing could be said for physical therapists. They're movement experts. I'm a movement expert. That's what I study. So when you go in and go see PT, you don't have to be in pain. You just say, all right, can you check me out? Do I have movement tests, movement deficits that we can test and assess? And then what do we do about it? All right. So, and then, you know, physical therapy isn't all just exercise and electrical stimulation. So there's much more, and we go a lot deeper in it whenever you come in to see me. All right. So that's the end of my slides. I promise I don't have anything else. So anyway, let's look at the clock. It's almost 1:30, almost time for me to go. So if you have any questions, feel free, use that chat box. I don't think that there's anything, but I'll give it the 30-second countdown, and then I'll let you all go and enjoy your sunny Tuesday. All right. Well, thank you for joining me today. You could look for this session and many more on demand on any of the Better Spaces apps. I'll be back Tuesday, March 5th. For functional fitness. It's training for real life movement. We're going to explore the concept of functional fitness and its importance in daily life. We'll discuss how to train for real life movements, improving strength and mobility for activities you encounter regularly. And you know, this upcoming session will feature practical exercises that mimic functional movements, helping you stay fit for the activities that matter most to you. So it's a little bit more about going into those later slides that we talked about. All right. If you have any questions, you could email me here at paul@par5pt.com or team@betterspaces.com. All right. Thank you for coming and be well.